announcing that the launch of the Hamilton COVID Concierge Business Program is on. So Hamilton COVID Concierge offers a one-stop online resource center and phone line dedicated to supporting Hamilton businesses with all their COVID-19 business questions and concerns. Local businesses that require support can call the new COVID Concierge phone line to speak with a representative at 905-521-3989. This service is available Monday to Friday, 8:30 to 4:30, or they can visit the online resource center at hamiltoncovidconcierge.ca. This concierge service support is for Hamilton businesses as a collaboration between the City of Hamilton, the Hamilton Business Center, and the Flamborough, Hamilton, and Stony Creek Chambers of Commerce. The Hamilton COVID Concierge for Business program is a direct recommendation from the Mayor's Task Force on Economic Recovery and will be in place until the end of the pandemic. So I'm confident the concierge service will be a trusted and reliable source for assistance for Hamilton's business community so we can thrive once again. Once again, visit hamiltoncovidconcierge.ca to learn more. A reminder as well that while we are no longer under the stay-at-home order, we must continue to follow all public health and safety measures in order to protect the health and well-being of everyone in our community. We must make sure we don't get complacent when we see our case numbers go down and our economy slowly reopen up. We are still in a crisis with a deadly virus in our community and potentially with some variants that could continue to cause us some challenges. So don't let our collective hard work go in vain. Please continue to follow the health and safety measures and recommendations in terms of staying within your own household as much as possible, wearing that mask, washing those hands, and maintaining that 6 meter or 1 meter, 2 meter distance. So thank you for tuning in, and thank you for your ongoing good work out in the broader community. And please stay with us as we continue to work through these very challenging days. I'll now turn it over to our Emergency Operations Center Director, Paul Johnson. Paul?
Thanks very much, Mr. Mayor. And not a lot new from the Emergency Operations Center today. We continue to, of course, monitor and enforce where necessary under the red control category in the City of Hamilton. And encourage everyone to continue to follow the rules, whether you're individuals or businesses. And we are still proactively and reactively responding 7 days a week through the day and into the evening. None of that changes as even though, as the mayor says, we're no longer under that stay-at-home order, we still are now enforcing to the level that's there. You will see media pieces that we put out, and thanks to the media for sharing the information that, you know, when you're out tobogganing, doing some of these outdoor events at city-sanctioned facilities, if you're lining up or in lineups or too close to people on a regular basis, we really want you to wear your masks outdoors as well. And it's been great to watch the community by and large comply with that. Our outdoor rinks continue to operate. We're not sure for how much longer. The temperatures are starting to rise, and our outdoor rinks will soon disappear because of the natural course of the weather. But as long as we can keep them going, and we hope that's for another couple of weeks at least, that we'll continue to do that as well. Did want to address that clearly there have been some increased numbers of outbreaks in terms of number of sites, as well as a large outbreak at one of our emergency shelters in terms of the volumes of people that are affected. But remind the community that we continue to have shelter spaces available. And so I know that at times it's been said that shelters are no longer accepting new individuals. That is the case in certain shelters, but there are still shelter beds available and access to shelter. And where that's not available, there is access to hotels. And if people are referring and for some reason they're not able to get a positive response that there is a space, ask that be escalated. There are occasions where communication glitches happen, and the city is always there to step in and make sure that we can find the right spaces for people to be in. So I just want to end that piece by talking about how much I really want to thank our shelter operators for the work that they've done throughout this pandemic. And a lot of times the city answer of emergency shelter spaces and oversee the system as a whole. And then there's lots of people to comment on shelters, but I thought today it would be great just to mention that, we're talking about a small number of organizations who have absolutely stepped up and are delivering great services on a daily basis. And even in outbreak, they are doing everything that they can to continue to provide services to those that are their residents and get back online as fast as they can so that they can continue to receive new individuals into their shelters. And so to James and Eminent at Salvation Army, we know that you're going through a particularly tough time now in terms of the outbreak and the size of the outbreak at your booth center location. And thank you for all that you're doing. We're helping where we can, providing some extra supports and extra funding to help Salvation Army through. But to those folks, I really appreciate it. And to Catherine and Tessa and Carmen and Daryl at Good Shepherd Centers, you've been there to open additional centers. You've been there to operate our emergency center at First Ontario back in the early stages of this pandemic, and are dealing with a number of shelters for a variety of people, including youth, families, and women, as well as the men's shelter system. So I really appreciate the work that's happening there. And to Carol and to Sean at Mission Services, thanks for stepping up and also providing some additional staff for our hotel spaces. And some other organizations are doing that as well, but you have really stepped up to allow us to have way more hotel spaces than actually we thought we would need even in the fall heading into the winter. But we've continued to expand our hotel spaces as we've needed to, as our shelter spaces become tightly constrained. And then from a kind of temporary shelter perspective, of course, the work that the YW is doing is appreciated along the way. And I've mentioned some of the leaders in those organizations, but the supervisors and the frontline staff that work 24/7 really do need to be commended for their work. So I can't remember the last time it is that I said thank you to the people that work in our emergency shelters, but I know that since New Year's Day, when outbreaks started to happen in some small ways, and now we have a significant number. And by the way, Hamilton's not unique. In fact, I was on a health call yesterday and over the weekend, actually communicating with folks in Windsor and in the Waterloo area and Niagara, who are all experiencing similar things. These folks that deliver those services on behalf of this community deserve a hearty thank you, and they are true heroes alongside all of those that provide frontline service. So wanted to mention that, particularly with what shelters are going through at the moment. Thanks, and with that, turn things over to Dr. Richardson.
Thanks very much, Paul. So going to give some updates on our stats and go through the vaccine pieces and a few other things as well. So 10,205 cases total in Hamilton as of today, which is 38 new cases compared to yesterday, 356 active cases, 279 deaths, and that includes one new death that was reported today. We're currently reporting a total of 22 local outbreaks on our website, and there was one new outbreak that was reported today, and that is at St. Elizabeth Retirement Residence. Our overall 7-day moving average in terms of at 51 and our reproductive number at 0.95. Of course, as always, you can find more details about our local COVID-19 activity on our website. So just in talking about the data, I want to point out a few things because I'm increasingly concerned that we have hit the bottom of the curve and may be beginning to see creeping back up. Time is going to tell. As always, it's the trends that we look at rather than a single day's data. But what we've seen over the last couple of days is we have seen that our weekly incidence per 100,000 has come back up into the 50 zone. We have seen our RE, our reproductive rate, hit 0.95 again, and we have seen an increased number of outbreaks. So it's very much something that we are concerned about, and it may be that we're at another critical point in this pandemic. So while things may have opened up a little bit as of last week, we have also had the COVID-19 variant detected or confirmed to have been detected locally. And so I cannot stress enough how important it is that we not let our guards down down at this point. It is absolutely vital that members of the public, even those who have been vaccinated, continue to practice public health measures until it is safe and said to be safe by the health professionals in all levels of government. So of course, I'll go back. These include staying home if you feel unwell, getting tested for COVID-19 if you have any symptoms that are related to COVID-19 or have been in close contact with a confirmed positive case of COVID-19, limiting gatherings to only the members of your immediate household, maintaining that physical distance of 6 feet, wearing a mask or face covering indoors and outdoors as well when you're not able to maintain physical distancing, and of course, washing your hands. I did mention as well the COVID variant of concern, the variants of concern. And we've of course identified locally the B117 variant. So just a reminder, we have had revisions in our management of all COVID-19 cases. So because we don't find out about whether it's a variant of concern or not, but we do of course know it's been transmitting both in Hamilton and elsewhere in Ontario. We do this with every case of COVID-19 when they're identified to us. So all identified close contacts are managed, and there's an increased sensitivity, if you will, in identifying those close contacts of cases. So if there's any suspicion about the exposure, they will be designated as close and require a 14-day quarantine following their contact with the case. We are asking that all close contacts immediately get tested, whether they are symptomatic or not. So that was a change from what we had recommended previously, but these are all stepping up the measures in the face of the variants of concern. We are also testing all those close contacts again around day 10 of their 14-day quarantine period again, regardless of whether or not they got symptomatic. If they were to become symptomatic in the meantime, they should also get tested at that point. New for this is as well that all household members of a close contact of a positive case will be asked to quarantine for 14 days unless it's absolutely essential to leave the home. And if that close positive contact does develop symptoms, all of their close contacts will be directed to quarantine until the test result has come back negative. The other thing I want to speak to is about how we've been reporting on the variants of concern. So we've been pointing residents to the Public Health Ontario webpage for updates on the number of confirmed positive cases containing a variant. We've recently learned that samples for which the screening test for variants of concern is positive, nearly all of those go on to be positive on the confirmatory test. So previously we had been reporting only confirmed positives, but because we're finding, or that Public Health Ontario has reported that nearly all those that are screened positive or by the screening test go on to be confirmed, we're going to update our practices and start reporting on those that screen positive. This makes sure people get the information in a timely way, because it does take an additional week to 2 weeks to do the whole genome sequencing to confirm that positive. So you can see we're fairly far down the line by the time we have that information. And so we think people need to understand that earlier to be able to understand what is going on with the epidemiology. The other thing is we've seen, since we had our own first case reported to us, that it's taken some time to get it up on the PHO website. And so we are going to start reporting both the screen positives and the confirmed positives on our own website in order to make sure that information is there in a timely manner. So you'll see that on the website over the next couple of days. I can't tell you it'll be up there tomorrow, but it will be up there in the next couple of days as we make the changes to the website to accommodate that in that status of cases section within our daily updates. I just want to point out again, the screening test doesn't tell us which variant it is. It just tells us that it may be a variant of concern. And as I said, most of these are going on to be confirmed to be a variant of concern. For us today, I'm going to give you our numbers of where we sit today. Today, we have 21 cases that have screened positive to date, and still just the one that has been confirmed to be positive, and that was confirmed as the B117 variant, or the UK lineage variant. So that's around the variants of concern. I'm going to go on to talk about the COVID-19 vaccine. And so as of end of day yesterday, we completed a total of 31,249 vaccine doses here in Hamilton through the 2 sites that are currently operating. The mobile site has done 10,565, and the HHS Fixed Clinic site is at 20,684. We did present on Friday to the Board of Health our COVID-19 vaccination plan, and we put an update as well related to that on our website at www.hamilton.ca/COVID vaccines. I encourage everybody to take a look at the plan, get a better understanding of how the vaccinations are going to be rolled out across the city. Now, that does look at rollout over time and as we get more vaccine going forward. So right now we have our current list of eligible vaccine recipients, and our next list that has been released by the province is those that are 80 years of age and older, staff, residents, and caregivers in retirement homes and other congregate settings for seniors, such as assisted living. So you'll know we have moved forward on that front. Healthcare workers that are in the highest priority level and very high priority level have been done. The high priority level, I know that can be a bit confusing. There's 3 levels of high that are in there, but the high priority level in accordance with the Ministry of Health's guidance on healthcare worker prioritization. All Indigenous adults, whether they're living in remote communities or urban areas, and then adult recipients of chronic home care. So the province has not yet given us a way to move forward on the adult recipients of chronic home care, so we're still awaiting that from the province. One of the challenges for all of us in this, the province and ourselves, is that getting all of the information systems, the technology stood up is quite a difficult process and takes a lot of work, basically. And so we're working with the province around implementing a registration tools where people can register to say, you know, which group are they with, and then would go on to be booked into a vaccine clinic. And so the province is working on developing it for the whole province. And in the meantime, as we're trying to move this forward, we're trying to put in place some tools that can be used in the short term until that provincial system is up and running. And so we're hopeful to have an update on that for you very soon. Another piece of this is about the vaccine supply. And you'll remember that I spoke to this last week and said, we're getting about 5,000 doses, that sort of range of doses per week. So of course, that's a very modest supply. And so for us to roll forward with our vaccination program, we really are able to move forward in very small increments right at the moment. And so while you look at the plan and see there's plans for a bigger vaccination program, that's once we get more sustainable supply through the province. And they are suggesting that's going to start to happen at the end of March, beginning of April. We do know that there was some comments about, you know, how family doctors might be able to help with getting people registered. At this point, we would ask that residents not call their family doctors to ask to be registered for a vaccine. We know that everybody is very eager and we're very pleased that people want to get vaccinated, but family doctors are not yet prepared to do this piece for it. And here in Hamilton, we're still working out what's the most efficient way for everybody to get registered as soon as they can. And so we'll have instructions for our primary health physicians, but as well for those individuals directly to register too, as we look to get this rolling. So just overall want to let you know that we have completed the vaccinations through our mobile clinic so that all second doses have been given to residents of long-term care and high-risk retirement homes that were planned. Of course, there will be some people who may have gotten missed or may not have wanted to be vaccinated at that time, and they can be caught up as we go forward. All first doses of vaccine have been given to residents of low-risk retirement homes at this point, as well as to the Satellite Health Facility and to St. Peter's. And this week, we are working our way through the remainder of the ALC patients, the alternative level of care patients who are waiting for a spot in long-term care. The HHS Fixed Site Clinic is continuing to complete the second doses for healthcare workers, essential caregivers, and long-term care and high-risk retirement home staff. And as we wait for more supply and move forward this week on Friday, the projections show that those dosage timelines of staying within the 42 days for our healthcare colleagues who are getting vaccinated at the moment, that we'll be able to meet those dosage timelines. So that is good news. So with that, Mr. Mayor, I will turn it back to you.
Thank you very much, Doctor. It's quite a slew of information. I'm sure there'll be some questions associated with that. So we'll look to the Dr. Richardson question period coming up shortly. And as well as this briefing, we do want to continue to remind people that mental health and being well and having challenges through this pandemic is an important topic that we don't want to forget about. So if you're having challenges, it's okay not to be okay. So feel free to call COAST at 905-972-8338 or the Kids Help phone line at 1-800-668-6868. You can also visit our website, which has a number of agencies and partner organizations on it, which can help, hamilton.ca/COVID mental health. There continues to be light at the end of the tunnel. We're closer to the end of this pandemic than we are at the beginning. But we have very, very much more work to do. And thank you all for that continued hard work in our broader community. We know that it's difficult. It causes a lot of anxiety in lots of people. I think we all feel it to a degree, and certainly some impatience. But we need to stay together and stay focused on ensuring that we can get to these vaccines, which is going to go a long way to having helped some already, and will go a long way to helping more once that supply is available to the general populace. So stay tuned, and we will do our level best to get this out to you as quickly as we get it. With that, I'm going to hand it over to Jasmine for the Dr. Elizabeth question period.
Thank you, Mr. Mayor. We'll start with questions from Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Thanks very much for taking my questions today. The first is surprise for Dr. Richardson. I wanted to ask last week, so the second week back to school, there were more than 40 cases reported and 3 outbreaks declared, and then a 4th outbreak was declared today. I just wonder if you could comment on how significant this is, and does it mean that more needs to be done to reduce in-school transmission?
Thanks, Kate. In terms of what we're seeing in the schools, we, as I've talked about, both in the first wave of the pandemic and this wave, as we opened up the schools, we definitely expect to see cases occurring in the schools. There are going to be instances where there is transmission that happens within a school, and the key piece is to keep these absolutely to a minimum as we go forward. And so it is when we looked back at some of the information we had from the before Christmas period to the before holidays period, we know that most of the transmission was still happening in the homes, although there was some transmission that was happening as well between students and staff. That was certainly happening. But as we go forward and look at this, it's why whether we're talking about out in the community and reducing transmission as much as possible and keeping case rates low, that is really critical to keep COVID-19 as much as possible out of our schools. And then in the school environment, making sure the enhanced PPE provisions, that students are following those, wearing the masks, doing those elements of it. The screening piece that has been put in place is really important. And we know the province is changing their changed their screening guidance to make it so that you'd be more likely to screen in with only one symptom being required. And then as well on the staff perspective, both that screening, the wearing of masks and PPE, and also what they're doing during break times to and from school, all of those times are really critically important. So not really something different that we need to do in terms of an added measure, but making sure, as we've talked about before, that those are followed, all the time is really important to do.
Thanks. And my second question is also for you, Dr. Richardson. Can you provide any further information about the outbreak at St. Teresa of Avila last week, which is listed as having 8 cases, while other recent outbreaks have just 2 or 3 related cases? Do we know why there were so many cases? And are there any suspected or confirmed cases of new variants related to this outbreak?
Thanks, Kate. At present, I'm not aware of any of the VOCs being related to any of the outbreaks. In terms of specifics on that particular outbreak, Jack or I will get back to you after this call with anything related to that one.
Great. Thanks, Dr. Richardson. Next question will be to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. My first question is for Paul Johnson. Do you know if any residents from the Salvation Army have been moved to the Banetto isolation shelter? I know that there were some staffing issues impacting that earlier this week and maybe over the weekend. I don't know if that's changed.
So actually, there were never any staffing issues that caused concerns at the shelter. They did have some staff that obviously needed to isolate, but the staffing shifts were filled, continue to be filled, and because of the size of the outbreak, the approach at Salvation Army was not to look at moving individuals into the isolation center. Essentially, we'd just be setting up a full-on shelter within an isolation center. So we've been doing work at on-site and sheltering and supporting people and isolating them on-site at Salvation Army. So working with public health, there's been a series of meetings that is the approach we're going to take, and it's consistent with what we've done in other congregate settings. Where the isolation center really works well is when we can quickly identify a single case, a couple of cases, move people quickly into there and not affect the rest of the shelter. But in this case, the volume was already so high in terms of positivity that working with public health, it was felt it was best to solidify it in place. What we did as a city to also help with staffing is things like arrange for catered food to be brought in, so people are having food delivered to them in their rooms, the areas where they're staying, and that has allowed Salvation Army to redeploy some staff instead of having to do all the kitchen prep that they would normally do on a daily basis. They're available to support the various elements of work that need to go on there. So as of today, and there was a meeting earlier on today, staffing continues to be, it's always tight in shelters. It's the same story in long-term care, retirement homes. None of these places were overstaffed heading into this pandemic. So it's tight, but there's not been situations where staffing has got to a level where we've had to step in with additional staff or think about decanting Salvation Army. Last thing I'll say is we've also supported with some on-site security, which again helps with encouraging people to stay isolated and in areas where they're not congregating together. It's tough with this population to have people stay isolated all the time, but we're doing what we can to support Salvation Army with all the great work that they're trying to do to make sure that they follow infection prevention and control measures and encourage this population, to be supported and seek the help they need, but also recognize that they need to, follow public health measures as best as they possibly can.
Thank you. And then my second question is for Dr. Richardson, and it's about asymptomatic testing in schools. So now that we're in the third week back to school and there are some schools with high case counts and as well as outbreaks, will resources be mobilized to offer asymptomatic testing in schools wherever an outbreak is declared, or is there like a predetermined schedule that will be followed in order to meet the weekly 5% target for testing?
Thanks, Fallon. So that weekly target is up to the schools, to the school boards to look at how they are going to meet that target. Certainly, there are circumstances in which we do look at additional testing that we would consider it. So, for example, if we were concerned that there were a number of cases that didn't seem to be any relationship between them and they didn't have any explanation for why they were happening, that they'd been in contact with other cases at home or that sort of thing. That would be a circumstance where, from a public health perspective, we would be looking at doing more screening of asymptomatic individuals. For anybody who's a close contact, we already require them to get tested, and it wouldn't be through this program. It would be through the testing and assessment centers using a different kind of test than this program uses, and it's really important that it happen through that route. So we are supporting the schools as they make decisions about how they're going to meet those testing targets, just giving them information about what we do see with the epidemiology of COVID in terms of what they might want to do. But the full program is really something the school boards are responsible for, and the resources to do it are something that the Ministry of Education has put in place. They've hired vendors to do that.
Thanks, Dr. Richardson. Next question, I believe, is to Phil Perkins from CHCH. Phil, if that's you, you can go ahead.
Hi there. Can you guys hear me?
We can, yes. Thank you.
Right. So it seems like Halton has released, I think, 4 vaccination sites once, I guess, they get enough vaccines to start their plan. Hamilton hasn't yet. I understand they have the main location and they have the mobile unit. Are there going to be more that are going to be announced at a later date?
Hi, Phil. So we've announced 3 at this point. So we have announced the HHS site and the St. Joseph's Hospital site on the mountain, as well as the mobile sites that we are doing at the current time. As you'll see in the plan, there is and in the presentation, there's sort of provisions for providing different kinds of sites, and exactly which ones we open up is going to be dependent on the flow of vaccine that we get. We do know at some point pharmacies as well are going to come online with being some type of vaccine provider, but it's not clear yet that we have a vaccine that is amenable to be used in those sorts of situations. So we are, that's the way it's rolling out at this point. And as we have more information and more vaccine, which is the critical component, then we'll be able to announce more sites.
Right. And also on the plan site, it mentions in like the preamble, while COVID-19 vaccines will be offered to everyone who wants one by the end of 2021, the Prime Minister is saying everyone who wants one will get one by September. So is there just like a miscommunication, or do you know something we don't know?
So I think, Phil, it really comes down to, what we're seeing with the vaccine rollout and where we're at. And so we're understanding we're going to have more vaccine as we get into April. And so seeing that we're going to continue the rollout through the priority groups through those spring and summer months. And then hopefully sometime in that last quarter of 2022, we will have broader broader availability of 2021 of vaccine for anybody who wants it. So I wouldn't read too much into one group saying September, the other group saying the end of 2021. Basically, it's all going to come down to when the vaccine supply comes, and people can understand and see the phasing, and they can see from our site where it is that we understand the phasing to be from the provincial government, which is of course who we're working with.
Thanks, Dr. Richardson. Next question will be to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Great. Hi, good afternoon. My question is for Dr. Richardson. And I was hoping to clarify what household members of a close contact should do specifically in the context of schooling. So if an 8-year-old student was a close contact, could their parents go to work, maybe in high traffic work scenarios? Could their siblings go to school? What is considered essential activities in there?
So what I'm going to do in this case, Christine, is Jack and I will send you something in writing, because I find I often mix my words around some of the pieces with the household contacts and the close contacts. So we're going to send you back that one in writing.
Okay, great. Thank you so much. And my next question is also for you, Dr. Richardson. So the provincial government says that 5 people are permitted for indoor social gatherings for a municipality in red. And what is the city directing people to do right now? And does this conflict with that?
So in terms of where we're at in red, the way I would interpret the guidance from the ministry, that broader framework is these are the broad set of rules that we're operating under. But just as with any rule, that doesn't mean that's exactly what you should be doing at any point in time. I'll use the speed limit as an example. If you're, the speed limit may be posted at 80 or 100, but if circumstances show that you shouldn't be doing that, then you should be driving at a lower speed. And it's definitely the same as we're going through COVID-19. While there may be some level that you're not going to get in trouble if you go over that rule in terms of enforcing the current Reopening Ontario Act, we're not recommending that people go ahead and do those things. So even on the provincial sites, I think you'll see that it's very much recommended that people continue to only mix with people who are from their own households, and take all the public health measures that we're recommending.
Thanks, Dr. Richardson. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions. Dr. Richardson, the Ontario Medical Association today at a press conference, they talked about exactly what you just finished talking about, only their thought was that if you tell people they can do it, they will. So, are you looking at putting in any specific measures yourself, especially, as you're seeing our numbers, possibly start to tick up again? Are you looking at adding any specific measures for Hamilton to try and control the spread?
Thanks, Joanna. I appreciate it. It's always important for us to continue to look at and be really aware of it. I'm glad you're highlighting that as we go forward. You know, as I expressed earlier, I'm very much concerned that we're just at the bottom of that curve, and that curve is we are starting to see climb again. And so we'll be watching that very closely over the coming days. Right now, there's not anything extra that we're going to put in place. We're going to continue to watch and see what happens with those variants of concern. If those numbers continue to rise, then that's something that will lead us to be talking more with the Chief Medical Officer of Health and saying, okay, when do we make some changes here? And as we gain more experience across the province around those, that will help us in making that decision. The other piece is if we ever see something that's a specific challenge that we see over and over in Hamilton, so there's some patterns that we're seeing. So we talked before about we saw patterns where people were going to work when they were sick. And so we implemented active screening in workplaces, for example, back in December. So right now, there's not any patterns that we're seeing that we could make a difference in terms of putting in more control measures. Really, if rates, we do continue to see rates rise, we're really going to be talking more about that emergency brake provision.
That leads actually perfectly to my next question, which is, do you have yet the metrics or whatever it is that would trigger that emergency brake? I know the last time we asked this, you said the province hadn't, got those to you yet. Do you have that information now?
Thanks, Joanna. At this point, no, we don't have that from the province. We know they are working with our colleagues up in North Bay in terms of understanding their situation and are, essentially using those kinds of provisions now and learning from them. And certainly, as I said, if we see any of those indicators, we'll be working with them and learning with them as they go until they actually have them set out. So that's just part of the reason why we're actively monitoring and continuing the dialogue with the province based on what we see each week.
Great, thank you, Dr. Richardson. We do have a bit more time, so we'll go through for one more question for everybody. We'll start with Kate McCullough. Kate, if you'd like another question, you can go ahead.
Thanks very much for the additional question today. I just wanted to follow up on Fallon's question about asymptomatic testing. I just wonder that there are currently 4 schools in outbreak, one of which offered rapid tests last weekend, as well as PCR, from my understanding from the school. And I just wonder, from a public health perspective, Dr. Richardson, if you could let us know, will the other 3 schools in outbreak also receive rapid tests for asymptomatic students and staff? Like, will that be offered to schools in outbreak in the future?
So generally in outbreaks, what we do is look at the cohorts that are affected and look at getting them tested through that system where they're actually going through the assessment center. So anybody who's a close contact, we are asking them to go through the assessment centers and be tested in that way rather than through a rapid testing program. So where we see something more in terms of transmission, that's really more where we're looking at it. So in each case, it depends on what's actually happening in that school, what that school is like, what the environment is like, and how much is clearly defined. And you can see there's limited contact between groups and how much you see that there's broader spread. So it's really, we can't give you a we'll use it always in these circumstances type answer around those outbreaks, but we'll look at each case as it comes to make a determination as to what we would recommend. We're realizing too that there are 2 different types of rapid testing. And so one of those, the ID now, is one that is potentially more useful in those circumstances as opposed to the PanBio.
Great, thanks, Dr. Richardson. Next, we'll go back to Fallon Hewitt. Fallon, if you'd like another question, you can go ahead.
Thank you. My third question, I guess, would be for Dr. Richardson, I believe. So those who use and work at shelters, they're not among those next in line for the vaccine. Do you know when they're set to be vaccinated? And is public health advocating for them to be moved up on the list, considering the situation in the city's shelter system at the moment?
Thanks, Fallon. So when you were speaking to actually the residents within the shelters, I believe, correct?
Yes, and the staff as well.
And the staff. So it's a bit of there's sort of, as they've updated the provincial guidance, there's sort of a separation of groups in terms of which phase they fall into. So those that provide personal, services to those in shelters, they fall into this first wave of the highest and very high priority workers in terms of moving forward. So they would be captured in terms of moving forward. The residents, on the other hand, and some of the other staff in the shelters would not at this point. And so we're working on looking at further clarification. But the bottom line here in Hamilton is we don't have enough vaccine in order to move forward with these groups. So as we look at it and look at the numbers of doses we have, we need more vaccine to be able to move forward with all of these priority groups. When we do look at the vaccine, it's not a measure for use in outbreak control. It doesn't help us in that way. It is something that we're using more from a preventative standpoint, and so that is one of the factors for consideration as well. But the bottom line is we need more vaccine.
Great, thank you, Dr. Richardson. We'll go back to Phil Perkins from CHCH. Phil, if you'd like another question, you can go ahead. Actually, it looks like we lost Phil. We'll go on to Christine Rankin, CBC Hamilton. So Christine, if you'd like another one, you can go ahead.
Sure, thanks so much. I believe this question will also be for Dr. Richardson. So with the city moving to including screening on the website, will it also go a layer further with that data and show if those screen variants are linked to any of the outbreaks listed?
So we're just working out exactly how we're going to get it up there for you. And so I would stay tuned on that one.
Okay, we'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks for the extra question. I appreciate it. This one's for Dr. Richardson. The Ontario Medical Association, they are calling for an end to indoor dining in the red zone. And Peel's medical officer of health said with the variants, the framework is out of keeping with evidence. Do you have concern about the, that COVID-19 color-coded framework as it is in place right now? And are there changes that you would like to see to it?
Thanks very much, Joanna. I think, we know that the province revisited the framework to look at what would happen as we went into this next phase. And there's been some very important adjustments that have been made. As we talked about the stuff that I put in my letter of direction back in December around active screening, all of those elements have actually been included in the regulation. So very glad to see that they've been updated. And as we move forward, we'll continue to look at what we're advising we see needs to be done. Certainly dining has been one of the ones that has been of concern because that's a situation where people are taking off their masks and are sitting together. And so we saw the limitations in terms of the number of people at the table. Those sorts of things have been put in place. We very much advise people, if you are going to go out and dine, this should really be something that you're doing just with your own household measures. It's critical too that members. It's critical too that the servers, the staff working in those environments have all the PPE that they need to have, and that they too are being screened, of course, as they're going in. There's been introduction of screening into those environments. So there's a lot of measures that are there, but as I said, the wisest thing we can all do is to stay home and make sure we're not mixing with other people from those outside of our household.
Great, thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Well, thank you, Jasmine, and thank you, Dr. and Paul Johnson, for your ongoing work. And I must say that the public health under your leadership, Doctor, and the entire team have been doing some amazing work. And I know it's frustrating for a lot of people to not have vaccines in their arms already. It's not of your doing, and certainly we are ready and prepared. And it's a question that I ask our health professionals every day. And you will know and need to know that that our teams are ready, willing, and able to get these vaccines in arms as soon as that vaccine supply is available to us. So we'll continue to kind of work on that. And thank you, Doctor, and your entire team for all the great work you're doing to manage this pandemic. It's been a journey, and certainly taken an awful lot of leadership from you and your team to get us through, and we thank you for that. Bill Custers, we thank you as well, and the Clear Cable team, Cable 14, and everyone else that's worked on making these media advisories a smooth broadcast. And if you need additional information on COVID-19, you can always go to hamilton.ca/coronavirus. Lots of information there for you. And if you haven't done so already, download the COVID Alert app on your smartphone through the App Store or Google Play. It is a very, very helpful tool for you and for everyone else, in fact, to ensure that you're not coming into contact with anyone that's COVID positive. And please continue to do the work you're doing out in the broader community. And as the doctor said, even though there's a limit of 5 in terms of bylaw, it is still your best judgment to avoid getting together with others as much as possible is the best way for you to protect yourself. And then, of course, wearing that mask and maintaining that 2-meter distance is part of that procedure as well. All of those are the best vaccines right now, as short of a vaccine. So continue to take those measures and you will protect yourself. Failing to do so puts you at risk. And certainly, hopefully, by the time the vaccine gets to all of us, we'll be in a better place closer towards September, October, November. Thank you all for your continued work. And on coming March, we will be going back to our Monday at 3 p.m. briefing. So our next briefing will be Monday, March the 1st at 3 p.m. Stay safe, everybody. Look after one another. And we'll talk to you on March the 1st at 3 p.m. Thank you.